What is the significance of maintaining patient confidentiality, and how do legal frameworks such as GDPR influence healthcare professionals' practices regarding data privacy? Answer: maintaining patient confidentiality is a cornerstone of healthcare practice that ensures that personal health information is protected from unauthorized access, preserving trust between patients and healthcare providers. The legal framework that governs data privacy in healthcare, particularly in the UK, is the General Data Protection Regulation (GDPR). Under GDPR, healthcare professionals must ensure that patient data is processed lawfully, transparently, and securely. The key principles include lawful basis for processing. Healthcare professionals must have a valid reason, such as consent or contractual necessity, to process patient data. Data minimization. Only the data necessary for the specific purpose should be collected. Security. Appropriate technical and organizational measures must be taken to protect patient data from breaches. Transparency. Patients must be informed about how their data will be used. Failure to comply with GDPR can result in significant penalties, including fines up to €20 million or 4% of global turnover, whichever is higher. Explain the ethical and legal principles behind obtaining informed consent in healthcare and describe how a healthcare professional should assess a patient's capacity to consent. Answer: informed consent is both an ethical obligation and a legal requirement in healthcare practice. It ensures that patients have the autonomy to make decisions about their own care based on a clear understanding of the risks, benefits, and alternatives to any treatment or intervention. The key ethical principles behind informed consent include autonomy, respecting the patient's right to make decisions about their healthcare; beneficence, the acting in the best interests of the patient by ensuring they understand the treatment options; non-maleficence, avoiding harm, which includes ensuring the patient is fully informed of the risks. The Mental Capacity Act 2005 (MCA) governs the assessment of a patient's capacity to consent in England and Wales. According to the MCA, a person must be assumed to have capacity unless proven otherwise. Capacity involves the ability to understand the information relevant to the decision, retain the information for as long as necessary to make the decision, weigh the information in the balance to make a decision, communicate their decision. If a patient lacks capacity, a best interests decision must be made involving family members, carers, and relevant professionals. HCPC standards require healthcare professionals to obtain and document informed consent and to respect a patient's decision, even if it involves refusing treatment. Failure to properly obtain informed consent can lead to professional misconduct charges and legal action. Mr. Robinson, the 72-year-old patient with dementia, is presented with a treatment option for his condition. His daughter is present in the consultation room, and she believes that Mr. Robinson would benefit from the treatment. However, Mr. Robinson appears confused and unable to recall relevant information about the treatment. What should the healthcare professional do in this situation? Answer: in this situation, the healthcare professional must assess Mr. Robinson's mental capacity to make an informed decision as required under the Mental Capacity Act 2005 (MCA). Since Mr. Robinson appears confused, it is crucial to assess whether he meets the criteria for capacity as outlined in the MCA. Understanding the information. Does Mr. Robinson understand the information about the treatment, including risks and benefits? Retention. Is he able to retain the information for long enough to make a decision? Weighing the information. Can he weigh the information in the balance to make an informed choice? Communicating the decision. Is he able to communicate his decision even if through nonverbal means? If it is clear that Mr. Robinson lacks capacity, then the healthcare professional must act in his best interests, consulting with his family and other relevant professionals. The daughter's opinion should be taken into consideration, but the final decision must be made based on Mr. Robinson's best interests, ensuring he receives appropriate care without any coercion. What are the professional boundaries for healthcare professionals, and how can conflicts of interest arise in healthcare settings? Provide examples of both. Answer: professional boundaries are the limits that define the appropriate, safe, and ethical relationships between healthcare professionals and patients. These boundaries ensure that care is provided in a way that is respectful, transparent, and prioritizes patient well-being. Boundaries are crucial to prevent any boundary crossings or violations, such as becoming overly familiar with a patient or using a position of power to exploit a patient. Examples of professional boundaries include avoiding personal relationships with patients that could impair objectivity, ensuring that physical contact is appropriate and necessary for treatment, keeping interactions focused on the patient's care rather than personal interests, A conflict of interest arises when a healthcare professional has competing interests that could influence their judgment or actions, potentially compromising patient care. For example, a doctor who has a financial interest in a pharmaceutical company may be influenced to prescribe a specific drug that may not be the best option for the patient. Another example would be a healthcare professional accepting gifts or favors from patients or pharmaceutical companies, which could lead to biased decisions. How does the duty of candor affect healthcare professionals' actions when an error or adverse event occurs, and what steps should be taken to comply with this duty? Answer: the duty of candor is a legal and ethical requirement for healthcare professionals to be open and honest with patients when something goes wrong during their care. It includes a duty to inform the patient when an adverse event occurs, explain the consequences, and offer appropriate apologies and corrective measures. The Health and Social Care Act 2008 regulated activities. Regulations 2014 requires healthcare professionals to inform the patient of the adverse event in a timely and transparent manner, apologize to the patient for the harm caused, offer a clear explanation of what happened, the implications for the patient's health, and any corrective actions or further investigations that will take place. Failure to comply with the duty of candor can result in disciplinary action by regulatory bodies like the HCPC, as well as potential legal action. Furthermore, it can undermine the trust between patients and healthcare professionals. Describe the legal obligations of healthcare professionals to promote equality, diversity, and inclusion in their practice. What challenges might arise when working with diverse populations, and how should these be addressed? Answer: healthcare professionals have a legal and ethical obligation to promote equality, diversity, and inclusion in their practice. Equality Act 2010 mandates that healthcare professionals must not discriminate against patients based on characteristics such as age, disability, race, religion, gender, or sexual orientation. They must provide equitable care, ensuring that all patients receive appropriate, respectful, and culturally competent treatment. Challenges that might arise include language barriers. These can be addressed by using professional interpreters or translation services. Cultural misunderstandings. Professionals should educate themselves about the cultural practices and preferences of the populations they serve. Discrimination or bias. Healthcare professionals should be aware of any unconscious bias they might have and ensure they treat all patients with fairness and respect. Training in cultural competence and adherence to policies promoting inclusivity are essential steps in addressing these challenges. The HCPC's standards of conduct, performance, and ethics stress the importance of treating every patient with dignity and respect, regardless of background. How should healthcare professionals handle situations where a patient refuses treatment due to religious or personal beliefs? Answer: healthcare professionals must respect a patient's autonomy and decision-making capacity, even if that decision involves refusing treatment. If a patient refuses treatment, the professional should ensure that the patient fully understands the consequences of their decision, including the risks of refusal, explore the reasons for the refusal, whether it is based on religious or personal beliefs, offer alternatives or compromise solutions where possible, provide the patient with the opportunity to reconsider their decision, ensuring they are fully informed. If a patient refuses treatment that is life-saving or critical and there are concerns about their capacity to make an informed decision, the healthcare professional must assess capacity under the Mental Capacity Act 2005. If the patient is deemed to lack capacity, a best interests decision must be made, potentially involving family members, carers, and relevant professionals. Explain the concept of professional misconduct and the types of actions or behaviors that might be considered professional misconduct by the HCPC. Answer: professional misconduct refers to actions or behaviors by a healthcare professional that fall below the standards expected by the regulatory body, the HCPC. This can involve breaching confidentiality or failing to protect patient data as required by GDPR, providing substandard care or acting incompetently, which could put patients at risk, engaging in unethical relationships with patients, violating professional boundaries, fraudulent behavior such as falsifying patient records or overbilling, substance abuse or other behaviors that impair professional practice. Misconduct is typically assessed based on whether the behavior significantly deviates from the standards of conduct, performance, and ethics set by the HCPC. The HCPC investigates allegations of misconduct and may take disciplinary action, including suspension or removal from the professional register. What are the ethical principles behind patient autonomy, and how do these relate to the role of a healthcare professional in decision-making? Answer: Patient autonomy is a fundamental ethical principle in healthcare, referring to the patient's right to make informed decisions about their own care. Healthcare professionals must respect and support this autonomy by providing patients with all the necessary information to make informed decisions, while also ensuring that they understand the risks, benefits, and alternatives. Autonomy is closely related to the principle of informed consent. Patients must have the ability to understand and make decisions based on their own values and preferences. Healthcare professionals must not impose their own values on the patient, but should provide guidance, support, and alternatives as needed. Ms. Taylor is a healthcare professional who notices that one of her colleagues, Mr. Brown, has been prescribing medications inappropriately and not following standard procedures. What should Ms. Taylor do in this situation? Answer: Ms. Taylor is ethically and legally obligated to report the inappropriate actions of her colleague under the duty of candor and HCPC's standards of conduct, performance, and ethics. By failing to follow proper procedures and prescribe medications inappropriately, Mr. Brown is jeopardizing patient safety. Ms. Taylor should gather evidence. Before reporting the issue, she should ensure she has a clear understanding of the facts and any relevant documentation. Report the concern. She should report her concerns to the appropriate authorities, such as her employer or the regulatory body. Follow internal procedures. Many healthcare organizations have specific channels for reporting misconduct, which Ms. Taylor should follow. Failure to report concerns can lead to allegations of complicity and may result in professional misconduct charges for Ms. Taylor as well. Ensuring patient safety and well-being must always be prioritized. What is the primary difference between type 1 and type 2 diabetes in terms of pathophysiology? Answer: the primary difference between type 1 and type 2 diabetes lies in the underlying mechanisms of insulin dysfunction. Type 1 diabetes (TD) is characterized by autoimmune destruction of the beta cells in the pancreas, which are responsible for producing insulin. This leads to an absolute insulin deficiency, meaning that individuals with TD have little to no insulin production. As a result, their blood glucose levels rise significantly and they require external insulin administration to regulate blood sugar. Type 2 diabetes (TD), on the other hand, is primarily caused by insulin resistance. In this condition, the body cells become less responsive to insulin, and over time, the pancreas struggles to produce enough insulin to maintain normal blood glucose levels. Initially, the body compensates by producing more insulin, but over time, the pancreas fails to keep up, leading to high blood glucose levels. TD is often associated with obesity, sedentary lifestyle, and genetic predisposition. Key differences: TD, autoimmune destruction of beta cells resulting in insulin deficiency; TD, insulin resistance and eventual beta cell dysfunction. A 65-year-old male patient presents with complaints of shortness of breath, wheezing, and coughing, particularly at night. He is diagnosed with chronic obstructive pulmonary disease, COPD. What is the pathophysiology of COPD and how does it affect gas exchange in the lungs? Answer: chronic obstructive pulmonary disease (COPD) is a progressive inflammatory lung disease that causes airflow obstruction and difficulty breathing. The pathophysiology of COPD involves long-term damage to the lungs, particularly the airways and alveoli, due to chronic exposure to irritants like cigarette smoke or environmental pollutants. The two main components of COPD are chronic bronchitis. Chronic inflammation of the bronchial tubes leads to excessive mucus production, narrowing of the airways, and difficulty expelling air. Emphysema, destruction of the alveolar walls, leads to a loss of surface area for gas exchange and reduced lung elasticity, resulting in airflow limitation. In COPD, the airflow limitation is primarily due to airway narrowing and mucus hypersecretion. In chronic bronchitis, loss of alveolar surface area and reduced elastic recoil. In emphysema, impact on gas exchange. The damage to the alveoli in emphysema reduces the surface area available for gas exchange, leading to impaired oxygen exchange. Additionally, mucus obstruction in the airways reduces ventilation, contributing to carbon dioxide retention. The imbalance between ventilation and perfusion (VU mismatch) worsens oxygenation and results in low arterial oxygen levels, which is why COPD patients often present with hypoxemia. Relevant guidelines rules. COPD management typically includes bronchodilators, beta agonists, anticholinergics, and inhaled corticosteroids to reduce inflammation. Long-term oxygen therapy is recommended for patients with severe hypoxemia. Mrs. Parker, a 58-year-old woman with a history of osteoarthritis, visits her physician complaining of increasing joint pain and stiffness, especially in her knees. She has been using over-the-counter pain relievers, but they no longer provide adequate relief. The physician suggests a joint replacement. What are the key anatomical and physiological factors involved in joint function, and how do they relate to Mrs. Parker's condition? Answer: the joint is a structure that connects two or more bones in the body. In Mrs. Parker's case, her knee joints are likely affected by osteoarthritis OA, which is characterized by the degeneration of articular cartilage and underlying bone. Understanding joint anatomy and physiology is crucial for understanding the mechanisms of OA and the potential benefits of joint replacement. Key anatomical and physiological factors. Articular cartilage. This smooth, elastic tissue covers the ends of bones in the joint, reducing friction and absorbing shock during movement. Synovial fluid. A viscous fluid that lubricates the joint, reducing friction and providing nutrients to the cartilage. Ligaments and tendons. These structures provide stability and support to the joint, allowing controlled movements. Bone. The underlying bone structures provide strength and support to the joint. In osteoarthritis, there is cartilage breakdown, which leads to pain, swelling, and reduced range of motion. The body attempts to repair the damaged cartilage, but the process is often insufficient, leading to joint deformities and bone spurs. Over time, the synovial fluid may become less effective, contributing to the loss of joint lubrication. Relevance to Mrs. Parker's condition. The degeneration of cartilage in OA leads to increased friction and pain, especially during weight-bearing activities like walking. A joint replacement surgery, such as a knee replacement, involves replacing the damaged joint with a prosthetic to restore function and reduce pain. Relevant guidelines rules. Treatment for OA may involve NSAIDs for pain relief, physical therapy, and in severe cases, surgical interventions like joint replacement. How does hypertension lead to left ventricular hypertrophy, LVH, and what are the potential consequences of LVH on the cardiovascular system? Answer: hypertension, high blood pressure, is one of the leading causes of left ventricular hypertrophy, a condition where the left ventricle of the heart thickens and becomes stiff. Pathophysiology. In response to sustained high blood pressure, the left ventricle works harder to overcome the increased systemic vascular resistance. This leads to ventricular remodeling, which includes thickening of the myocardial wall, hypertrophy. Over time, the thickened left ventricle becomes less compliant, meaning it cannot relax and fill with blood as efficiently. This can lead to diastolic dysfunction, where the heart struggles to accommodate blood during the relaxation phase. Consequences of LVH. Impaired cardiac output, as the left ventricle becomes stiffer, is less able to pump blood effectively, leading to symptoms such as shortness of breath and fatigue. Increased risk of arrhythmias. The structural changes in the myocardium can disrupt the electrical conduction system, increasing the risk of arrhythmias like atrial fibrillation, heart failure. If untreated, LVH can progress to heart failure with preserved ejection fraction, HFpEF. What is the role of the blood-brain barrier, BBB, in the pathophysiology of neurological disorders, and how does it impact drug delivery to the brain? Answer: the blood-brain barrier, BBB, is a selective permeability barrier that protects the brain from potentially harmful substances in the blood while allowing essential nutrients to pass through. The BBB is formed by endothelial cells that are tightly joined together, restricting the passage of large molecules and pathogens. Role in neurological disorders. In conditions like stroke, traumatic brain injury, and multiple sclerosis, the BBB can become disrupted. This allows harmful substances, e.g. immune cells, toxins, to enter the brain and exacerbate damage. In neurodegenerative diseases like Alzheimer's disease, the BBB may become less effective at clearing out harmful proteins like beta amyloid, leading to accumulation and further neuronal damage. Impact on drug delivery. The BBB presents a significant challenge for delivering therapeutic drugs to the brain, particularly large molecules and biologics. Many drugs cannot cross the BBB easily, limiting treatment options for neurological disorders. Drug delivery strategies. Techniques like nanoparticle-based drug delivery, intranasal administration, and the use of drugs that can cross the BBB, e.g. lipid-soluble compounds, are under investigation to improve drug penetration. Relevant guidelines rules. The development of BBB-targeted therapies is an active area of research, particularly for treating conditions like glioblastoma, Alzheimer's disease, and Parkinson's disease. Explain the role of nitric oxide, NO, in the regulation of blood pressure and vascular tone. Answer: nitric oxide, NO, is a potent vasodilator that plays a critical role in the regulation of blood pressure and vascular tone. It is produced by endothelial cells lining the blood vessels through the enzymatic action of endothelial nitric oxide synthase, ENOS. Mechanism of action. NO diffuses from the endothelial cells to the underlying smooth muscle cells of the blood vessel walls. Once inside the smooth muscle, NO activates guanylate cyclase, leading to an increase in cyclic cGMP. This causes smooth muscle relaxation, resulting in vasodilation, widening of blood vessels. The vasodilation reduces vascular resistance, which in turn lowers blood pressure and improves blood flow to organs. Impact on blood pressure. Endothelial dysfunction, a condition often seen in hypertension, diabetes, and atherosclerosis, leads to reduced NO production, contributing to increased vascular tone and elevated blood pressure. Nitric oxide is also involved in regulating blood flow to various tissues, ensuring proper oxygen delivery. A patient with a history of asthma is prescribed a long-acting base agonist LABA inhaler. What is the mechanism of action of LABAs and how do they benefit asthma management? Answer: long-acting base agonists, LABAs, are bronchodilators that help manage asthma by relaxing the smooth muscle in the airways, allowing them to open up and make breathing easier. Mechanism of action: LABAs work by stimulating beta-2 adrenergic receptors in the smooth muscle of the airways. This activates the cyclic AMP pathway, leading to smooth muscle relaxation and bronchodilation. The effects of LABAs are prolonged due to their long half-life, which allows for sustained bronchodilation over 1 to 4 hours. Benefits for asthma management. LABAs are used to provide long-term control of asthma symptoms, especially nocturnal symptoms or exercise-induced bronchoconstriction. They are typically prescribed in combination with inhaled corticosteroids to address both the underlying inflammation and the bronchoconstriction. ECA patient with chronic kidney disease, CKD. How does the body attempt to compensate for decreased renal function, and what are the potential consequences of these compensatory mechanisms? Answer: in chronic kidney disease, CKD, the kidneys gradually lose their ability to filter waste products and maintain electrolyte balance. The body initiates several compensatory mechanisms to maintain homeostasis. Compensatory mechanisms: hyperfiltration. The remaining healthy nephrons in the kidneys increase their filtration rate to compensate for the loss of function. This increases the workload on the kidneys. Renin-angiotensin-aldosterone system (ROS) activation. In response to decreased renal perfusion, the kidneys release renin, which triggers the production of angiotensin II and aldosterone. These hormones increase sodium retention, which raises blood pressure and helps maintain blood volume. Erythropoietin (EPO) production. The kidneys produce more erythropoietin in response to reduced oxygen delivery to the kidneys, leading to increased red blood cell production to counteract anemia. Consequences of compensatory mechanisms. Hyperfiltration can lead to glomerulosclerosis, worsening kidney damage over time. RAAS activation increases blood pressure and contributes to the development of hypertension and heart failure. Increased erythropoietin production can lead to polycythemia, which may increase the risk of blood clots. Relevant guidelines rules. Angiotensin-converting enzyme ACE inhibitors or angiotensin receptor blockers (ARBs) are commonly used in CKD to reduce the impact of RAAS activation and slow the progression of kidney damage. What is the role of the liver in lipid metabolism, and how do alterations in liver function affect lipid profiles in the body? Answer: the liver plays a central role in lipid metabolism by synthesizing, modifying, and regulating lipid levels in the bloodstream. It is involved in the synthesis of cholesterol, the production of lipoproteins such as LDL and HDL, and the conversion of excess carbohydrates and proteins into fatty acids and triglycerides. Liver's role in lipid metabolism. The liver synthesizes very low-density lipoproteins (HDL), which are converted into low-density lipoproteins (LDL) in the bloodstream. LDL carries cholesterol from the liver to peripheral tissues. The liver also produces high-density lipoprotein (HDL), which collect cholesterol from tissues and transport it back to the liver for excretion. The liver regulates fatty acid synthesis and triglyceride production, converting excess nutrients into storage forms of fat. Alterations in liver function. Fatty liver disease (steatosis) can lead to abnormal lipid metabolism, causing elevated triglycerides and reduced HDL levels. Cirrhosis and liver failure can impair the liver's ability to synthesize lipoproteins, leading to elevated LDL cholesterol levels and poor lipid clearance. Relevant guidelines rules. In patients with liver disease, managing lipid levels becomes crucial to prevent cardiovascular complications. Statins are often used to lower LDL and total cholesterol levels. How does the process of oxygen dissociation from hemoglobin occur in the tissues, and how is this process influenced by factors such as pH, temperature, and co-concentration? Answer: the process of oxygen dissociation from hemoglobin occurs as oxygen is released from the hemoglobin molecule to the tissues where it is needed for cellular metabolism. Mechanism of oxygen dissociation. Hemoglobin has a high affinity for oxygen in the lungs, but this affinity decreases in the tissues where oxygen is required. The Boer effect explains this change in affinity. Low pH, acidic conditions, increased co-concentration, and higher temperature all promote oxygen dissociation from hemoglobin by reducing its affinity for oxygen, making it easier for oxygen to be released to the tissues. Factors affecting oxygen dissociation. pH. In tissues with high Co levels, carbonic acid dissociates to produce H ions, lowering the pH, which decreases hemoglobin's affinity for oxygen. Boer effect. Temperature. Increased temperature, such as during exercise, also promotes oxygen dissociation. Co-concentration. Elevated Co levels in tissues as a byproduct of metabolism also reduce hemoglobin's affinity for oxygen. Explain the concept of a herd immunity and its significance in public health vaccination programs. What challenges do health professionals face in achieving herd immunity in communities, and how can these challenges be addressed? Answer. Herd immunity occurs when a significant portion of a population is vaccinated, reducing the likelihood of disease spread even to unvaccinated individuals. This community protection is crucial in preventing outbreaks of contagious diseases, especially protecting vulnerable populations who cannot be vaccinated, such as individuals with compromised immune systems. Challenges in achieving herd immunity include vaccine hesitancy, misinformation about vaccine safety, logistical issues in vaccine distribution, and socioeconomic barriers. Health professionals can address these by engaging in public education campaigns that address vaccine myths, promoting transparent communication about vaccine risks and benefits, and collaborating with community leaders to improve vaccine accessibility. Relevant guidelines. The World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC, emphasize public education and transparency as essential strategies in vaccine campaigns. They recommend targeted educational initiatives that consider cultural, religious, and social factors influencing vaccine acceptance. Maria, a 35-year-old patient, visits the clinic with concerns about heart disease as her father recently suffered a heart attack. She smokes, leads a sedentary lifestyle, and admits to a high-fat diet. What counseling approach should her healthcare provider take, focusing on lifestyle and behavioral modification? Answer. The healthcare provider should adopt a patient-centered counseling approach, focusing on small, achievable goals to address each risk factor. This could include motivational interviewing to explore Maria's readiness to quit smoking, reduce dietary fat intake, and increase physical activity, setting specific, measurable, and time-bound goals, e.g., reducing smoking, gradually incorporating moderate physical activity like walking, and gradually shifting to a heart-healthy diet can facilitate adherence. Relevant guidelines. According to NICE, National Institute for Health and Care Excellence, guidelines, effective behavioral counseling for lifestyle changes should involve setting personalized goals, providing clear information on health risks, and offering follow-up support. Behavioral interventions and resources. The smoking cessation programs tailored to individual needs enhance the effectiveness of lifestyle counseling. Describe the role of health education strategies in managing chronic conditions. What are the key elements that make an educational strategy effective for chronic disease management? Answer. Health education strategies in chronic disease management involve equipping patients with the knowledge and skills to manage their conditions proactively. Key elements include clear communication. Information should be conveyed in simple, accessible language. Goal setting and self-monitoring. Encourage patients to set specific health goals and monitor their progress. Empowerment and self-efficacy. Help patients feel capable of managing their condition. Support systems. Establish regular follow-ups, support groups, or educational workshops. Effective strategies increase patient adherence to treatment and improve health outcomes by fostering patient empowerment and responsibility. Relevant guidelines. The American Heart Association and other health bodies recommend structured educational interventions, emphasizing goal setting, self-monitoring, and periodic assessments to adapt educational strategies based on the patient's progress and learning needs. Discuss the importance of screening programs in disease prevention. What ethical considerations should healthcare professionals keep in mind when implementing screening programs? Answer. Screening programs are vital for early detection and treatment of diseases, reducing morbidity and mortality rates. They are especially important in conditions like cancer, diabetes, and cardiovascular disease, where early intervention can significantly improve outcomes. Ethical considerations include ensuring informed consent, respecting patient autonomy, and avoiding harm, non-maleficence, by reducing false positives that may lead to unnecessary anxiety or procedures. Equity and access is also crucial. The programs should be designed to reach underserved populations who may be at higher risk. Relevant guidelines. According to the Health and Care Professions Council (HEC), screening programs must adhere to ethical standards that respect patient rights, autonomy, and equitable access, and must provide clear information on the risks and benefits associated with screening procedures. Dr. Thompson is responsible for implementing a new diabetes screening program in a rural community with limited healthcare access. What key steps should Dr. Thompson take to ensure the program's effectiveness and accessibility for this population? Answer: Dr. Thompson should conduct a needs assessment, assess the specific health needs and barriers in the community, collaborate with community leaders, engage local leaders to promote the program and build trust, ensure accessibility, provide mobile screening services or partner with local organizations to facilitate access, tailor health education, use culturally appropriate materials and language to explain the importance of screening and follow-up care. These steps ensure that the program is well integrated into the community, addressing logistical and cultural barriers to accessibility. Relevant guidelines. HCPC guidelines emphasize community-based health programs and culturally tailored health education to enhance screening program acceptance and participation in underserved communities. Explain the role of lifestyle and behavioral counseling in preventing chronic diseases. What approaches can health professionals take to address barriers to behavioral change? Answer: lifestyle and behavioral counseling aims to prevent chronic diseases by helping patients make healthy lifestyle choices. Health professionals should adopt a multifaceted approach that includes motivational interviewing, helps to resolve ambivalence toward change, barrier identification and problem solving, identifies obstacles and develops practical solutions, support systems and follow-up, encourages sustained lifestyle changes through regular support and follow-up appointments. Behavioral counseling is most effective when it's patient-centered and addresses the psychological, social, and practical factors that affect behavior change. Relevant guidelines. According to HCPC, the integration of motivational interviewing and patient-centered goal setting in behavioral counseling has shown to increase patient adherence to lifestyle recommendations. Why is chronic disease self-management important, and what are the essential components of an effective self-management plan? Answer: chronic disease self-management empowers patients to take an active role in managing their health, improving their quality of life, and reducing healthcare costs. Essential components include education on disease management, providing information on managing symptoms, medication adherence, and lifestyle choices. Self-monitoring tools like glucose monitors for diabetes or blood pressure monitors for hypertension. Support networks, access to support groups, counseling, or regular follow-ups. Effective self-management programs are personalized and address both the medical and psychosocial aspects of chronic disease. Relevant guidelines. The HCPC advises that self-management programs should incorporate patient education, monitoring, and access to healthcare support systems to promote adherence and reduce hospital readmissions. Discuss the importance of public health awareness campaigns for vaccination. What factors influence the success of these campaigns? Answer: public health awareness campaigns for vaccination aim to increase uptake and ensure community protection against preventable diseases. Success factors include targeted messaging, adapting messages to resonate with specific populations, addressing vaccine hesitancy, providing clear evidence-based information on vaccine safety, accessibility, ensuring vaccines are easily accessible and affordable. These campaigns are essential to protect public health, especially during disease outbreaks, and rely heavily on clear, consistent, and culturally relevant messaging. Relevant guidelines. The CDC and WHO recommend multi-channel communication strategies to address vaccine hesitancy with a strong emphasis on transparency and public engagement. Jason, a public health nurse, is tasked with educating a community on the importance of preventive health screenings. The community has shown reluctance toward these screenings due to cultural beliefs and misconceptions. What approach should Jason take to ensure his message is effective and respectful? Answer: Jason should take a culturally sensitive approach by engaging community leaders, working with respected local figures to promote the message, using culturally appropriate materials, designing education materials that align with the community's values and beliefs, providing information on the benefits of screening, clearly explaining the role of screening in preventing illness and how it aligns with health and well-being. Jason's approach should focus on trust building and respectful communication to address misconceptions without imposing views. Relevant guidelines. HCPC guidelines recommend engaging communities in culturally respectful ways, involving local leaders, and using tailored educational strategies to increase screening acceptance. How can healthcare professionals support patients in smoking cessation? Discuss the methods and guidelines that enhance the effectiveness of smoking cessation programs. Answer: healthcare professionals can support smoking cessation by using evidence-based methods such as behavioral counseling and support, utilizing motivational interviewing to encourage quit attempts, nicotine replacement therapy (NRT), providing NRT options to reduce withdrawal symptoms, setting realistic goals and monitoring progress, establishing quit milestones and follow-up to monitor adherence. According to NICE guidelines, smoking cessation programs should incorporate behavioral therapy (NRT) and continuous support with a focus on personalized counseling that considers the patient's specific motivations and barriers. Relevant guidelines. The National Institute for Health and Care Excellence (NICE) recommends a combination of behavioral support and pharmacotherapy, as well as regular follow-ups to address individual needs and increase cessation success.